Good afternoon, Dr. Bregman. We have a lot more COVID-19 related questions for you.
Okay.
And today we're going to talk about being connected, which you're a huge proponent of, because being connected is good for the mental health. And of course, during COVID-19 and a lot of us stay home, it's really hard being connected to the rest of the world. So we actually have an email from Rhonda in Toledo, Ohio that deals just with this question. Being connected, Dr. Bregman, to friends and family is so important to me. I really miss the festive parties and seeing my grandchildren. What are your thoughts on staying engaged to my social network? I feel it's so important to not only stay in touch, but it's healthy just for my mental health. Wow, that question could be asked by millions and millions and millions of people in America. What do you do? What do you do to stay safe but stay connected?
I'm asked about this with a lot of people. It's so important. Humans are social animals. We really want to be connected, and we have been connected until now. With the virus, we're asked to be isolated. We have to be socially distant. We are afraid to visit each other for fear of maybe transmitting, and maybe this is a asymptomatic transmission issues. So we need to find creative ways right now to fill this void so our interpersonal relationships are fulfilled. Now, I've seen people do incredible things. I have this grandma, she babysits the kid on the video. So
oh, you're kidding.
Mom's out, another room, and grandma is there for like 20 minutes babysitting the child with a video. And I thought that was so creative.
Oh,
I just
where
had to
was
share
that
that
when my kids were little? I could have used that many years ago.
Oh, and I think the idea is what grandma did there was creativity. I mean, and you have to make an effort. I mean, like get together with friends on Zoom on a regular basis. Like Friday night is the night you talk to Stu, okay, and Teresa, okay?
Right,
so
with your quarantini in hand.
Right, and you have to make an effort. And how about all the meetings you'd go to? Well, make an effort, no matter if they're AA meetings or they're group therapy meetings or whatever kind of family meetings. Be creative and use the technology and use Zoom or FaceTime.
Right. Yeah, I've never spent so much time talking to my friends, either Zoom or just on the phone. I think that's really important to especially be cognizant of your older friends who are shut-ins right now, and just say, hey, Sue or Mary, how you doing? Reach out.
Honestly, one of the things like we're not really talking enough about is our older folks aren't that good on technology. So they're home really isolated. I mean, maybe they just have the phone and we can't go visit because people are afraid to see each other. So reach out, especially to those older folks, and with kids, just the way grandma did with other kids, your friends, and let's just get through this.
Yeah, because I know with some of my older friends, honestly, they're getting used to this isolation thing. And when there will be time where we come out of our houses and we meet and greet again, I'm a little worried that they're going to have a hard time leaving the cave, could that possibly happen if you stay in your home and you're isolated and you're not talking to anyone? It might not be so easy to get back into the swing of things with being social.
Oh, absolutely. Linda, we're going to have a real problem here. I talk to a lot of patients, and what my patients tell me is, I say, well, how you doing? And I have so many people, Doc, I'm really a homebody. So this isn't so bad. But really, they have social phobias. They always were. They came to me because, Doc, I get nervous when I'm out socially. Now I have all these people happy. They're staying at home, and how are we ever going to get these people out? So there is a subset of people who are really going to have a very difficult time when they can get out. I know we don't hear as much about that because people just can't wait to get out. But there's a lot of people that we don't talk about that are having trouble. You're going to have trouble getting out.
Well, when that happens, hopefully soon, that will make another great topic. I'm sure we'll get plenty of emails asking you about how to transition into, regular life.
There's no doubt about that. I think the living creatures that'll suffer the most are probably the dogs. As far as my dog's concerned, he says he loves this and he's going to be heartbroken when I leave the house and start going to work.
Well, that reminds me of another great topic for another time, which is pet therapy, but we'll leave that for another day.
That sounds good because I have a lot to say about that.
All right.
Okay.
Well, good seeing you as always. Great
Same
advice.
Bye-bye.
Bye-bye.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.